So this is the left os coxa, and it fits in the human body just like this. So there's three host bones that make up the os coxa. Turns out that it's the ilium bone, the ischial bone, and the pubic bone. And all three of them come together in the acetabulum. It turns out about 1/5 of the acetabulum is made up of pubic bone, 2/5 are made up of ischial bone, and also 2/5 are made up of ilial bone. And if you look in Netter's Atlas, it's beautifully illustrated in 3 different colors in this region right here. Okay? So let's take a look at the host bone first, the ilium. So first is the iliac fossa right over here. This is iliac crest. That's what you need to know there, iliac crest. There's an intermediate zone and an inner lip and an outer lip, but I'm mostly interested in iliac crest. This little bump right over here, about an inch or two posterior to the point over here, is called the tuberculum of the iliac bone.
Tuberculum, not tubercular.
Tuberculum, okay? So now we're gonna go like so, and this is anterior superior iliac spine, posterior superior iliac spine, anterior inferior iliac spine, posterior inferior iliac spine. While I'm here, this area right in here that's in the shape of an ear is the auricular surface, auricular, okay? This area all in here that's not the auricular surface is iliac tuberosity, okay? And to do the same thing on the sacrum, but on the sacrum it's not as nicely illustrated. I know there's a little bit of confusion about the sacral tuberosity, but we're mostly interested in the auricular surface, and then if you see like a little roughened area, that's iliac tuberosity. Okay, so this area right over here is the greater sciatic notch. This is the lesser sciatic notch, and it is separated by the ischial spine. Ischial spine. This area here is the arcuate line. This bump right over here is the iliopubic eminence. Iliopubic eminence. So this is the pubic bone. This is the pubic symphysis region. This is the superior pubic ramus. This is the inferior pubic ramus. Ramus means branch, as Dr. Reef told you. And so on the superior pubic ramus, there's a few things we need to know. This is called the pecten of the pubis. Pecten of the pubis bone, also known as pectineal line. This is arcuate line, this is pectineal line, this is iliopubic eminence.
That's on the anterior side?
Pectineal line is right up over here. Now hold on. I'm tilting it like this. This is the obturator crest. Obturator crest. And there's a groove, not nicely illustrated here, but the groove is called the obturator groove right in here for the obturator nerve, artery, and vein. This is the obturator foramen. This is the pubic tubercle right over here. And then there's something that there's a lot of confusion about. Not too many people know the specific answer for this, but the pubic crest is between the pubic tubercle and the pubic symphysis. So the pubic crest is right here. This is pectineal line. Sometimes people call it the pubic crest. That's incorrect. Pubic crest is between pubic tubercle and pubic symphysis right over here. Okay, so now here's the body of the pubic bone. Here's the symphyseal surface. We just covered all the stuff on the superior pubic ramus. This is the inferior pubic ramus. Draw an imaginary line halfway across. That makes this the ischial ramus. There isn't a superior or inferior because there's just one. It's just called ischial ramus. This is how this sits. This is called the ischial tuberosity. The whole thing is called the acetabulum. This is the acetabular margin, or rim would be okay. This is lunate surface. I'm not sure, but I think on that anatomy list that you guys might have, they might call it semilunar, and that's incorrect. It's just called lunate surface, Lunate. This is the acetabular notch. right over here. So we have rim, lunate surface, and notch. On the exterior surface of the ilium, you'll see in some of the anatomy atlases, there's superior, middle, and inferior gluteal lines. I'm not worried about those. They're not seen anywhere. They have to do with the attachments of the gluteal muscles, but we're not worried about those. You just need to know tuberculum of iliac crest. And I'm looking over here. I don't think that I forgot anything. I think that covers everything.